job in the hospital, the only job where we are at somebody's bedside 24 hours a day, 7 days a week, 365 days a year. We have people who work around the clock, but we're the only ones who get to be with the patient all the time. So nurses have a lot of responsibility to watch patients closely. Sometimes we take care of well people, like maybe you go to the doctor's office and you get a shot or something for school, or the health department. And sometimes we take care of very sick people like we do in the intensive care unit. But nurses have tools, and I want to see if you guys know what the name of some of my tools are, okay? First of all, this is an easy one. What's this?
Watch.
And we count people's heart rates, how fast their heart is beating, and we count how fast you're breathing by using the watch. It has to have that little second hand on it. So a watch is one of our tools. Here's another tool. Tell me if you know what this is called. I have some fun with it. Everybody knows what this is called.
Stethoscope.
Stethoscope. What do we do with the stethoscope? Huh? Where do these pieces go? Right here. They go in your ears, and this part goes where?
On your heart.
It goes over your heart, and it also listens to your lungs. You can hear the air going in and out. If anybody in here has asthma, when you get tight chest, you go ee, make squeaky squeak. You can hear that. Okay, squeaky noises. We also can listen to your stomach to see if things are working inside there. So this is called a stethoscope. Then we have another tool that we take what's called a vital sign. A vital sign, there's 4 of them. Heart rate, how fast your heart is beating. Respiratory rate, how fast you're breathing. What else? Blood pressure? Yeah. So what's this thing called that you take with the blood pressure? Who knows what this is called? It's got a good big name. This is my favorite toy. What is it called?
Squeezer.
Huh? Squeezer. That's a pretty good name. It's called a, ready for this? Sphygmomanometer. Can you say that? Sphygmomanometer. Big old word for a blood pressure cuff, isn't it?
Yeah.
Do you see the gauge on here?
Yeah.
I put that on someone's arm and I listen with my stethoscope right here, and I hear your heart beating, a top number and a bottom number. So we have to learn how to use these when we're nurses. Okay, that's another tool. Okay, I got one more in here. Who knows what this is?
Medicine.
It's a medicine bottle. And you know, medicine can be so pretty sometimes. It's the prettiest colors and the coolest shapes. But I tell every kid I teach, if you ever find a bottle that looks like it's got medicine in it, never ever open that bottle up and try one. Always take that bottle to an adult and let them put it in a safe place, because sometimes medicines can be very harmful if they're not intended for you. Whether it's a pill that makes your heart go too fast or too slow or anything else. So if you ever find a medicine bottle, you go take it to an adult right away and tell them that you found it. All right, what's this? There it is. It's your pajamas in the hospital. Look, we get to see you all the way around. And we put that on so that we can get to you and listen to things and touch things when we need to. Like listen to your heart, or maybe feel your legs. Maybe you've got an incision and you've got a bandage on it. We might need to look at it. So if you have regular clothes on, it'd be really hard to do that. So we put you in a hospital gown while you're in the hospital. We have them child size, which is so fun. Okay, one more toy. What's this?
Cast.
Why do you wear a cast?
Because you have a broken arm.
Yeah, this one's for your arm. How do you know it's for your arm?
Because it has
It's a thumb hole. That's right. See inside? Look at that inside there. Can you see that? It's nice and fluffy and soft, because this part is really rough, and it's just as rough on the inside. So we put casting gauze all the way around it so that it doesn't rub sore. And that keeps your bone lined up so your bone would heal. Now, a nurse does not put a cast on, but a nurse might help the doctor do that, unless the nurse has special training and they go into what's called advanced practice, and then they learn how to do those things. But that's more school. All right, one more, then I think my time is up. Am I right? Okay. What's this? Do we know?
Thermometer.
Yes, but the fancy one is a digital thermometer, so we can take a temperature just like that. And we can take, sometimes we have thermometers that put on your forehead, they put them right here in your temporal area. Sometimes they put them in your ear, and there's a probe, and it measures inside your ear. We put one under your tongue with this one. We take this out and put a plastic wand on and put it under your tongue, and it tells me how much temperature you have, so we can tell if you have a fever. So those are called vital signs that the nurse takes and writes those down and reports those. And then they maybe have to give you medicine for things that are wrong. So do you think nurses have an important job?
Yes.
Yes, and we need more nurses, because we know there's not going to be enough nurses by the year 2020. That's just 6 short years away. And we know we've got to encourage people your age to really think about a health career and think about being a nurse. And the best part about nursing is, if you get tired of working in one area of nursing, like, you're done taking care of babies, now you want to go take care of people, you know, that are maybe on a helicopter that go, you know, from one hospital to another, you can do that. So nursing has lots of opportunities, and it's a good way to make a living and support your family too.